Experiencing ongoing abdominal discomfort or feeling a mass after a bout of pancreatitis can be concerning, making you wonder what might be happening inside your body. It is natural to seek clarity when faced with such health puzzles, especially when complications arise. Yes, there are indeed several different ways to drain a pancreatic pseudocyst, and the best approach depends on many individual factors. A pancreatic pseudocyst is a collection of pancreatic fluid that can form after pancreatitis, and while some resolve on their own, others may require intervention to prevent complications like infection or rupture. The choice of drainage method primarily hinges on the pseudocyst size, its location, whether it is causing symptoms, and its proximity to other organs or blood vessels. If the pseudocyst is small, not growing, and not causing discomfort, a doctor might choose to simply monitor it. However, if it is large, infected, or causing issues like pain or obstruction, drainage becomes necessary. The exact characteristics of the pseudocyst, as determined by imaging studies, are crucial in guiding the medical team's decision. To drain a pseudocyst, doctors commonly consider three main approaches: endoscopic, percutaneous, or surgical. An endoscopic drainage involves guiding a thin, flexible tube through the mouth into the digestive tract to reach the pseudocyst from the inside, often using tools like an endoscopic ultrasound to ensure precision. Percutaneous drainage is a less invasive method where a needle and catheter are inserted through the skin directly into the pseudocyst, typically guided by imaging, allowing the fluid to drain externally. Surgical drainage, which is generally reserved for more complex cases or when other methods have failed, involves creating a direct connection between the pseudocyst and a part of the digestive system, such as the stomach or small intestine, to allow for internal drainage. The type of endoscopic drainage often utilizes an endoscopic ultrasound, or EUS, which combines endoscopy with ultrasound imaging to precisely locate the pseudocyst and guide the placement of a stent or drain. This technique is often preferred because it avoids external incisions and has a quicker recovery time compared to open surgery. Another specialized endoscopic procedure is called endoscopic retrograde cholangiopancreatography, or ERCP, which is generally used if there's an associated ductal issue. These advanced endoscopic techniques representing a significant shift from older, more invasive surgical methods, offering effective solutions with less impact on the patient. Understanding these different drainage options empowers you to have a more informed conversation with your healthcare team. The goal is always to choose the least invasive yet most effective method to relieving symptoms, prevent complications, and help you return to your normal daily activities. Your doctor will carefully evaluate your specific situation to recommend the best course of action for your pseudocyst, ensuring the safest and most beneficial outcome.